Well, millions of people have died since the start of the HIV/AIDS epidemic, and millions continue to live with HIV today. In this week's edition of Things You Should Know, a health official highlights the progress that has been made since the disease first appeared. Cleopatra Murphy has the details.
With some 37.9 million people across the globe living with HIV and another 32 million people having died up to the end of 2018, based on World Health Organization statistics, HIV and AIDS continue to pose a serious health challenge globally. From testing to treatment, advancements in medication have significantly improved patient outcomes. Acting Director of the National HIV/AIDS Center, Nurse Berniska Lewis, says those advancements include the speed of testing. Getting results no longer takes weeks.
We have the rapid test where it's a small prick in your finger, and after you've had a little prick, in 15 to 20 minutes your results will be available to you. Persons now, we're seeing the advent of home tests or self-testing. That's something that's now coming on board, so we just want to advise persons who may be performing their own self-test kits at home that you're still encouraged to come to us in the event that that home test says that you are HIV positive.
Lewis says in the early days of HIV, patients only received antibiotics. Then there was treatment for those who could afford it, and patients had to take a large cocktail of pills to manage their viral loads.
Now we're at a point where you can take one. We have persons who take one pill at bedtime or one pill in the morning, and that's it. And they're able to go and they're able to stay healthy and stay active and contribute to society.
Today in the Bahamas, treatment is free for anyone with a positive diagnosis, and patients can access care through various public health facilities throughout the country, from the Princess Margaret Hospital to various clinics. Lewis says today there is also treatment for those who are in high-risk relationships, that is, where there is one partner who is HIV positive, sex workers, men who have sex with men, or those involved with someone with many other sexual partners are also included in that category.
We have for that what we call PrEP, which is pre-exposure prophylaxis. A lot of persons, they have seen commercials for it. The drug that's used for that is Truvada. Persons, they see it and they think, I wish I was living in the States so I can get that. But you don't have to be living in the States because we have that available as well. And PrEP is also available free of charge to persons who want it.
Lewis says while there has been progress in many areas, public attitudes about people diagnosed with HIV and AIDS still needs work. She says some patients will not get treatment because they do not want to be looked down on.
We still have persons who are blatantly discriminating and who feel that if you're living with HIV, you should be cast aside. So we need to continue pounding and driving that message home that HIV is just like any other disease. Nobody asked for it. It's something that that person has to live with. And honestly, you haven't passed anything until you're dead. And it's a human rights issue as well. You know, discrimination, it doesn't help, it hurts actually.
Cleopatra Murphy, SAT&S Network News.